Okay, so welcome to our webinar. My name is Tamar Weiss from Aline Hospital, located in Jerusalem, Israel. EPTRI is a distributed research infrastructure that offers high-quality services in basic, preclinical, and translational pediatric research. EPTRI is composed of 5 thematic research platforms, and it is structured to enhancing technology-driven pediatric research in drug discovery and early pediatric medicines development phases by providing expertise, facilities, and methodologies focused on basic research for pediatric medicine discovery. Its mission is based on recognizing the importance of growth and autonomy characteristics in pediatric drug and device response, and the integration of preclinical and clinical research. This 4th webinar is organized within the 1-year educational program set by the EPTRI Pediatric Medical Devices Platform. During this webinar, we will delve into the strategies and benefits from the engagement of children and young people and families in pediatric health research, in particular, young stroke survivors and people with a disability of cerebral palsy. The talk is being recorded for posting on the EPTRI YouTube channel. You will receive links to that at some point shortly after the webinar. We have 3 speakers today, and I will introduce each one prior to their 20-minute presentation. I would like to ask you all to make sure that you mute yourselves throughout the presentations. At the end of all 3 20-minute talks, we will have time for a combined discussion. If you wish, you can post your questions, especially for those of you who can't stay till the end. You could post your questions on the chat and we will read them out to the speakers afterwards as whatever suits you. Okay, so I'm going to begin now with introducing our first speaker, Jenny Preston. Jenny is a senior patient and public involvement and engagement manager based at the University of Liverpool. Her main role for the last 18 years has been to deliver a strategy for the involvement and engagement of children and young people and families in the design and conduct of pediatric health research. Jenny is currently undertaking a PhD using a child rights approach to explore what meaningful patient involvement means to children and young people. Jenny will speak about the benefits of involving children and young people in research in user-centered design, using examples from her work with the National Institute of Health and Social Care, the NIHR, Children and Young People's MedTech Cooperative. Jenny, please share your screen, and I will give you a 5-minute warning towards the end of your talk.
Thank you, and welcome everyone. So yeah, my name's Jenny Preston. It's a pleasure to be here today. So as the introduction said, I'm here to talk about patient and public involvement in the work that we do, predominantly in the UK, but we work on international trial designs and international studies. So, but this is just from our experience in the UK. So as the introduction alluded to, I am involved and have been for the last, well, this is my 19th year actually, in this complex research and innovation structure that I have a leading role to deliver a patient and public involvement strategy to ensure the voices of children and young people throughout the research, design and conduct, whether that be clinical trials or in this case, today's presentation about health technology for children. And as was mentioned, my my working title for my PhD at the minute is Prepare. So it's preparing young people to have a voice and prepare researchers actually to listen to young people throughout the design and conduct of our research. So as I'm here today talking about child health technology, I'm going to be talking about what our experiences are in the UK, and I'm going to be presenting as my capacity as patient and public involvement executive lead for the National Institute for Health Research funded Children and Young Persons MedTech Cooperative. So we see in Paul Dimitri at the beginning of this call, who's I've worked with for many years now, and is the director of EPTRI for short. So our thanks to him today for some of the slides that I'm going to be presenting, although some of them are from the work that we've done as well. So I'm sure I don't need to tell you all what we mean by health technology, but just in case, it could mean anything from 3D printing, data analytics, assistive technology, sensors, and so on, but all with the aim of obviously improving the lives of children and to improve their health and well-being throughout their lives. So within EPTRI, we develop these technologies across, and we have been for the last 5 years, across 7 themes. And these include rare diseases, neonates, surgical technologies, respiratory, and so on. And I'm sure you've heard Paul talk in the past, but you know, as a network, we've achieved quite a lot over the last 5 years, and we've got a lot more to be doing for children's technology. So over the last 5 years, SIPMed Cooperative has made tremendous progress in what has been a rapidly expanding field of child health technology, from groundbreaking research to innovative solutions through to the development of the most advanced technologies. We've really witnessed so remarkable achievements that have positively impacted on children and young people. So our work over the last 5 years, here's some of our statistics, but I think most importantly for this purpose of this presentation today is this 159 figure of workshops and events that we've achieved. And when I say we, I mean the team, more so the team than I oversee the strategy for the patient and public involvement strategy, but the team have worked together with children and families in events and workshops to feed into the design of such technologies, which is absolutely crucial. And again, like I said, the purpose of my talk today. So central to all of these achievements is our founding principles of health technology developed for children, with children, and no health technology for us without us. So in the UK, we call this patient and public involvement. And what we mean by that is research carried out with or by children, young people and families, rather than to, about, or for them. And I really love this quote from Harper Lee, is you can never really understand a person until you climb into their shoes and their skin and walk around in it. So that's what we really believe in when we want to involve young people and families in our efforts. So my PhD is driven, as I mentioned, around patient and public involvement. And again, just to be clear, it's not on children or about children, it's with children and by children. So this can be achieved in many ways. And I'm sure my colleague Begonia on the next presentation will present some nice case studies of that as well. But really what we're driven by is the United Nations Convention of the Rights of the Child, in that children and young people have the right to have their views and opinions listened to. But more importantly, we as duty bearers to those who've signed up to the UNCRC have a duty to actually make sure that we listen to young people's views, and it's not just a tokenistic exercise. So really Article 12 is what drives us in how we involve children and young people. So not only does the UN of the Rights of the Child actually enforce Article 12, but it also sets out in the convention the right to the high standard of health and to the benefits and for young people to benefit from scientific advances. This is really laid out in the general comment number 25, and what the general comments are, if people aren't familiar with general comments, is a guide, the guide to actually how to deliver on a particular topic, and in this case, obviously, children's rights in relation to the digital environment. And that really informs us how we should, we have a right, we have a duty to protect the rights of children. And in terms of digital technologies and including health technologies, is that, these are the clauses within that comment to say that states should encourage and invest in research. And that's one of the things that CIPMedTech has had the benefit of over the last 5 years, funded by the government, which really puts the provision of health technology into to basically being driven by them, and to make sure that we really focus on children's needs as opposed to adult needs. And it says in this clause that digital services should be used to supplement or improve in-person provision of health services to children. And I think that's what we've achieved over the years. It says that states should introduce or update regulation that requires providers of health technologies to embed children's rights in their functionality, content and distribution. And that's what we really mean by patient and public involvement. Again, within this general comment, it's that states should involve children, especially in disadvantaged or vulnerable situations. And we know this is an issue, especially in the world of digital technologies, and making sure that everybody has access to digital technologies to help them. And so this is a problem, but it is a focus of our work, and I'm sure the next two presenters work as well. So when we talk about patient and public involvement, there's several terms that you can use, and user-centered design is also mentioned within the design of technology. So, we like to use this to understand the process and several steps you need to go through to involve patients and families in any type of technology. So, obviously you would get to understand patient stories and family stories to be able to empathize with their needs and identify unmet needs that need to be addressed. And then obviously you would go into define and what is the best technology to meet those needs. Then obviously the ideas would come out, and all of this comes out within these workshops with children and young people. You would go on to look at the alternatives and, analysing and developing prototypes. And obviously, as we all know, those prototypes took many years sometimes to test, go back to the drawing board and so on. So this is a nice flow of how we would embed involvement right the way throughout, not just as maybe in this section here, define and research. We really need to understand it from the patient's point of view. So in order to do patient and public involvement effectively and for it to be meaningful, we really have to make sure that the structures and the values of our organizations are in place to be able to allow children and young people and families to have the space, the voice, the audience and influence to basically design our technologies. That takes a lot of effort in terms of making sure that the space is child friendly, for example, so that we work around their needs, to be flexible. So a lot of the time I get asked to do workshops with young people that are in a weekday at a time that they may be in school, and it's just physically impossible to do that. Or you would get invited, young people get invited to attend adult-based workshops, which isn't suitable for young people to be able to have or feel confident to have the voice to be able to speak up and say what it is that they actually need and want. And I love this model. This is I don't know whether anybody's heard of this model, but it's by a professor in Ireland called Professor Laura Lundy, and it's called the Lundy model of participation. And basically this conceptualizes Article 12 of the UN Convention on the Rights of the Child. But it goes further than just listening to young people and listening to their voice, it goes into how are you going to act on that by who's the audience and how are you going to influence that.
Samo malo da odmorim, molim te. Može, naravno.
So it goes further than that, and there's a lovely checklist to actually make sure that that is covered when we involve young people. And alongside just the processes of involvement, we have to think about how we educate our young people or capacity build their understanding, awareness of both young people and families actually about, you know, the importance of their role in helping to shape the technologies of today and the future. And so this is a program that Begonia will be talking about a little bit more, but I was involved in from the University of Liverpool with Begonia's team, looking at developing modules on how to co-design protocols, and how to engage and involve young people in user-centered design. And this, the photograph in the middle here, is young people from our Young Persons Advisory Group in Liverpool and the Barcelona team, which was unfortunately about a couple of months just before COVID struck and we all couldn't meet again, which was unfortunate, but we still carried on with the co-development actually of these modules that, again, like I say, Begonia will be able to describe a little bit more. So the reason why, and I'm sure I don't need to explain this, but the reason why we involve patients in the public offers many benefits. But, you know, obviously within health technology, it improves functionality. It can improve the quality of that product, the usability and acceptability of those of the products. But from a industry stroke, you know, research perspective, you know, by involving children and families who are really going to be at the end users of such technology, you know, it basically reduces product failure. It actually gives, you know, young people's voices in terms of how best to effectively use that technology. More importantly, customer satisfaction, so that children and young people and families want to use these products that we develop. And obviously it's going to have an impact on obviously the product sales, because if nobody wants to buy it, then actually it's a redundant product. So I'm now going to show you this video because I think this is really important, because it really shows how involving young people in the development of technology really can impact on them and their lives so much. And if they're not going to use it, as I've just said in the previous slide, then it's absolutely pointless. But this is an example, again, kindly shared by Paul.
Excuse me, Jenny, five minutes, okay? Thank you.
Most of our kids have quite a long-term condition that they need to carry on doing their exercises for sometimes several years.
Keep that one held, so tight grip on the one on the right.
And they're doing the same things day in, day out. It gets really boring. No one wants to do it. Sometimes it's painful. It's just not really fun. They want to be out playing and doing things with their friends.
It's kind of a bit more playing than exercising, even though you are still doing your exercises. Like, it's fun as well. Oh, gosh.
You need a break or anything like that? Is your arm tired? Or?
No, it's fine. She didn't find it easy, whereas before she would have given things up very easily, but she wanted to keep going. She wanted to pop another balloon. And she wanted to reach that next thing, but she's just been an absolute trooper. She just has a smile on her face every day, so it kind of encourages me to be positive. We've had kids come in that can only get their arms up to here, and then they come in straight away and they're picking the arrows up and getting full range of movement and not even noticing. And then when we interview them after, they said that they didn't even notice any pain. So it's been a big shock to me how well actually it has worked to do what we needed it to do.
So that really shows that, you know, technology can really enhance young people's experiences in terms of their rehabilitation as well. So it's really important that we listen to young people's views. So I think it's exciting times. I'll just give you a whistle-stop tour of what we've done for the last 5 years, but we're moving into an exciting area now. And again, I get the pleasure of working with Paul now for the next 5 years. I don't know whether that's a pleasure for Paul, but actually, you know, we get to work on these cross-cutting themes with children and young people to basically, you know, again, advance our what we've done in the past. So, you know, we're going to be looking at research on early life, long-term conditions in childhood, transition, mind-body integration, and so on. So, and patients and the public will be absolutely central to all of this. So that's my final slide. I'm sorry that I couldn't offer you any more, but Begonia is going to offer you some case studies now of, you know, patient and public involvement in practice. Here's our details if anyone needs to contact me after this webinar. So I'll stop my share now.
Thank you very much, Jenny, for a really interesting talk. It really opened up the field and I think sets the stage for the next 2 talks. So thank you very, very much. There will be time for questions at the end of all 3 talks. So our second speaker of the webinar is Begonia Nafria. She is Patient Engagement and Research Coordinator at St. Jean de Dieu Children's Hospital in Spain. She has long experience in the field of involvement of patients and families in research initiatives. Her areas of expertise are focused on pediatric patients' involvement in research and specifically in the field of clinical trials and innovation. She is currently a PhD candidate in the patient involvement in pediatrics field, especially to enhance the pediatric cross-border clinical trials. Begonia will cover the importance of pediatric indicators for new therapies, particularly concerning rare diseases and the work of 14 Kids, the Pediatric Innovation Hub in San Jose de Dieu, Barcelona's hospital, and their collaboration with the European Young Persons Advisory Group Network, a consortium of experts who facilitate meaningful patient and public involvement with children, young people, and families across Europe. Begonia, please share your screen.
Hello, good afternoon to everybody. It's my pleasure to be today with all of you. And as Jenny Preston introduced a little bit about the concept of patient and public involvement, I will be more focused specifically in the involvement and in the participation as advisors of children and young people in the field of digital technology. And from San Juan de Deu, it's so relevant to explain.
Hi, Artu, it's me. Artu, it's me.
Sorry, something happened. I will share again. I cannot share my screen anymore.
Sorry, Begonia, try now.
No. It's working now? Yes? Perfect. Okay, from San Juan de Deu Children's Hospital, that we are the largest pediatric hospital in Spain. We are located in Barcelona. We have the pleasure to coordinate a network to promote the innovation in pediatrics. This network has the name of IFOKids and has the support of different institutions. It was born as a regional network, and nowadays it's a European network that is helping colleagues and professionals from different children's hospitals to promote and accelerate the innovation as soon as we can to develop digital solutions in the process to arrive to the market. Probably you are aware about the data of this slide, but it's important to mention that pediatrics, it's in a different position than the drug development or the medical devices staff if we compare with the adult setting. At this moment, one of, or it's another way to say 50% of the drugs in pediatrics are focused and addressed to rare diseases and are prescribed for label use. 90% when we are talking about newborns, And also the diagnosis of some conditions in pediatrics, it's a long process that in this, in some cases, it's 5 years or longer. It means that if we don't facilitate the process to accelerate the innovation in this specific field of medicine, sometimes we are arriving late to provide some quality of life, or even, it's a big word, but even in some cases, the cure of children. Something that for us as a pediatric site, and I know that other sites working together with us in this initiative, Fight for Kids, they are aware, is that invest today in children. To have healthy children today means, you know, to have a healthy society in the future. And this is an important statement for us, because it's the only way to convince to invest in a small market that it's innovation in pediatrics. And this is the reason of the network that I'm presenting today to all of you, i4Kids, that has as a mission to foster and promote innovation in pediatric and also in the maternity field, to provide, as I said, better quality of life to our patients and pregnant women. Said this, we work in a collaborative way. At the moment in this network, we have 30 top research entities, including hospitals, universities, and other kind of institutions, and the total number of research groups involved in this initiative is 92. From the side perspective of the children perspective, that it's where it's feasible to really implement this innovation, co-created and co-designed with the children and the young people and the parents. It's important to mention that we have the support and we work together with ECHO, that is the European Children's Organization hospital, that connects all these hospitals that you can see in the slide, that at that moment are 11 hospitals across Europe. We have delivered different initiatives, provided grants, supported and mentored projects, organized focus groups. This is some numbers in regards of our activities, but I want to highlight some specific projects in order that you can understand the value that the children and the young people can provide in this specific field, that it's the innovation and the digital health in pediatrics. And something that for us it's important is that everything that we need to do with our patient population needs to be, of course, aligned to the regulation. And you know that we have a European medical devices regulation that it's quite new. But for us it's important, this regulation, because at some point means a change in the way to study and to implement these medical devices, because we need to consider that clinical trials have to be executed in order to be sure that these devices are secure and work for their purpose. And this was an inflection point, because this regulation supports and encourage the activities that we try to do with our groups of young persons advisory groups or groups of patients or parents, in order to ensure that these studies, these clinical trials that we design and we co-design with them, help us to really analyze if the devices are working for the purpose and also are accepted in terms of the needs and the patient preferences, that it's one of the main outcomes that we have when we involve children and young people in this setting. Said this is one of the examples that I want to mention today to all of you. This is the Exploro APP. In this APP, we had the opportunity to include the diversity perspective, because it was a specific digital solution designed in the UK, and this company had the aim to extend the implementation of this APP to other countries, to other hospitals. And what we did at the Spanish level was with our patients, our young advisory group, to adapt everything to the context and to the standard of care that we have in Spain for children with pediatric oncology conditions. This is another example. It's BLAP. As you can imagine, the children that they need to follow regular therapies, at some point for them, it's boring to repeat the same exercise several times per week. And this is a digital solution that we cooperated with our patients, in this case for kids that they need exercises or rehabilitation for the speech therapy. And everything was co-created with them and for them, as my colleague Jenny Preston mentioned. They decided which kind of cartoons the EPP has to have, which kind of exercises, the name, etc. It was fully co-created with our patients to really make more adherent this therapy, because we saw that it's challenging for these kids to repeat, as I mentioned, several times per week, the same kind of exercises, and the therapy adherence was really relevant. This is another project that we have executed in our hospital, that is in regards of the experience that our kids they have in the process to go to the operating theater. As you can imagine, they are very anxious. They are very worried about what is going on. We work to prepare these surgeries with child therapies that we have in the hospital. But in any case, no, the moment before to arrive to the operating theater, even if they can go with their parents, it's a very hard moment for them. And we try to make it more friendly using this car that also help us to get some data of the patients in terms to measure, their blood pressure and any other, vital signs, to be sure, in which state they arrive to the operating theater. And for us, as Jenny mentioned, and for all these projects, it's so important to educate and empower our patients. When we work in these projects that are focused in a specific condition, I have mentioned, for example, childhood cancer, but we have had projects in cystic fibrosis and many other conditions. We prepare these groups of patients and parents to be involved in these initiatives, because for us it's very important that they understand what it's about in regards to the project. But also in general, for us, it's so important to have as a sites, as a hospitals doing innovation, because we have a very large department of innovation in our hospital. It's really relevant to have youth councils, these young persons advisory groups, really ready to be involved in our projects. And we are doing a big piece of work in regards of training. Jenny already mentioned the YEA project. The first edition of this program was focused in clinical trials in drugs, in medicines, but the second year of this project was focused in the process to co-create with the Young Advisory Group of Liverpool, and also the team here in Barcelona, several educational resources that help the facilitators of these groups doing PPI activities in medical devices to really empower them before to participate in real projects. And as you can see in the slides, it's really relevant to introduce them in this process of co-design. Also, we have done a lot of stuff in regards data sharing and the rights of the young people in this specific topic, because most of the devices are collecting data, and it's important that the young people understand their needs and their rights. And finally, why it's relevant to involve children, young people, and families in this specific setting, and help us as sites and as a children's hospital to disseminate and to increase the awareness about the role that they have in the development of digital technologies. This training program, it's based in case studies, because what we try to do is to replicate the real world of real projects in this training program before to involve these young people in specific projects. We have a lot of tools in a digital environment, and also we have these educational guidances for facilitators, but also for schools if they are interested to do some activities in their classroom, specifically, to do some projects and initiatives like we do in the real world. But all these initiatives and these projects are possible because we have a network, and we work collaboratively with this network of hospitals that I mentioned. And at that moment are more than 30 young persons advisory groups across Europe that we offer the opportunity to work together in common initiatives and common projects. For us, it's really meaningful work together because the diversity perspective, the standard of care, and many other variables are important in order to get the input, the feedback, and the preferences of children and young people from the different European countries in which at the end these innovation projects will arrive to their markets. Said this, we have different lessons learned from these many years working in the field. I think that Jenny already said 19. In my case are less years, but together with Jenny and many other colleagues, we have done a lot of stuff on collaborative projects. And I wanted to summarize here some lessons learned. The first one is that education, or let's say the involvement of children and young people, it's feasible. And it's something that we need to have always on mind. If we can involve in first person, then let's do it. Of course, there is the case of specific conditions that by the age or for the condition, we cannot involve them. In this case, always we have the opportunity to involve the parents. We need for every project tailored materials to train, to educate, but also to involve them in this co-design and this development of medical devices and technology. For us, it's the only way to ensure that a project is patient-centric, it's working together. Diversity again, and sorry because I'm highlighting a lot this word this afternoon, but I think that it's key and relevant and we need to have always on mind. And this collaborative approach that I mentioned, it's very important to work together with these different groups of patients across Europe to ensure that innovation, of course, will arrive to them, but of course, involve them in the project to deliver this innovation to the different European countries. At that moment, patient involvement, it's beneficial, it's common sense, it's positive, it's going to make, as I said, patient-centric the project, but it's not a mandatory project. This is something that we expect in the future. You know that we need to go to the regulatory agencies and to the ethics committees, and hopefully at some point this part of the process will be mandatory, and this is something that we are also working at the European level to do some lobby activity. As sooner we can involve the patients, the better. And as you can read in the slide, early stages are relevant because it's where we take important decisions about design. Report the feedback to the children and young people involved in these projects. It's very important because at the end they understand the value and the uniqueness of their contributions to these projects. And I think that still not all the stakeholders were, educated in this direction, but I think that it's part of the engagement that we need to do with the groups of patients to ensure that also they will increase their knowledge, their skills, but that also will be ready for, a continuous involvement and contribution to different initiatives. And at the end, it's
5 minutes. So sorry, Begonia, I just want to let you know 5 minutes left. Okay.
Yes, thank you. And 2 last points from my part. First of all, it's so important to work in this change of our mindset. And when I said here in the slide, it means, from all the stakeholders, regulatory agencies, the pediatricians and all the medical experts, engineers, etc. Everybody needs to understand the value of children and young people involvement. And it's a matter to incorporate in our processes the value and the activities that they can provide to us. And finally, this exercise to analyze and publish the impact of every project in which we involve children and young people. And with Jenny, we have done some common publications because it's also another tool to disseminate, but of course also to educate the different stakeholders involved in innovation. And this is my last slide. And again, to reinforce something that my colleague Jenny already mentioned, that it's important to emphasize that what we are talking about today, the involvement of children and young people, it's a right. We have the Conventions of the Rights of the Children that sets in the article number 12 that the children not have the right to access to this highest standard of health. And also we have the article 24, it's not mentioned in this slide, that refers to the decision-making process in health decisions, in which also we need to listen and ensure that the children are involved. And again, thank you so much for the invitation today to be today with all of you. And I think that it's really important that everybody today makes the exercise to see from their perspective, their position and their role, what you can do to ensure that children's involvement in digital therapeutics and medical devices it's feasible. Thank you so much.
Thank you very, very much, Begonia, for a very inspiring talk. I think that there's a lot of food for thought, and there are already some questions that are gathering in the chat, but we'll wait until the third speaker completes. Thank you very much. Okay, so I'd like to introduce our last speaker, Francesca Fedeli. Francesca co-founded Fight the Stroke Foundation together with her husband, Roberto D'Angelo, with the aim of developing inclusive solutions for young stroke survivors and people with cerebral palsy, as their son, Mario. Thanks to the use of technology, inclusive design, and science, Fight the Stroke has revolutionized family engagement in research and the Italian advocacy ecosystem with their solutions. It's the winner of numerous awards for being able to combine the most advanced discoveries in neuroscience with artificial intelligence and community-based healthcare. Francesca will provide us with an overview of how patients can and must be engaged in scientific research and how health tech can be a powerful enabler for a better child care. Francesca, please share your screen, and thank you very much. I'll give you a 5-minute warning after 15 minutes.
Thank you, and hello everyone. Hope you see well my screen. Okay, so today the aim of my presentation following Jennifer and Begonia is just to provide you with an overview about our foundation, which is basically a family foundation, and how family can be engaged, and generally speaking, people with lived experience can be engaged in research and development of digital therapeutics. I will share some examples of a mirrorable case, ANCP project, and Mirror HR app. And during the presentation, you will see different logos, just to clarify. The main logo of the presentation is the one of the ANCP project, so the one you will find at the top of the slide, which is the European project I'm going to talk in a while. While on the left side, the first logo, apart from the other alliances that we have established during the year, we have these two main entities, these two main souls, let's say. The Fight the Stroke Foundation, which is a foundation that has been built in 2014, so around 10 years ago, based on the experience of my family. And that has reunited 1,000 families in Italy and established worldwide alliances. But on top of this, during the years, we discovered that if we want to have an impact, especially in the development of digital therapeutics, we should have a more sustainable entity. So the logo that you will find, as I was mentioning on the left side, the FTAs, is our social enterprise, which is the entity that is in charge of the research, of the development, but also of the dissemination of our project. So our story, as I was mentioning, is the story of a family. When our son Mario was born in 2011, we discovered after 10 days that he suffered a perinatal stroke. So you can imagine how a parent of a newborn expecting a new life or building up a family was, on the other hand, trying to find a cure, a solution, or even to understand better. So in our case, it was a really hard job 10 years ago, more than 10 years ago, because there was no community, or there were neither people, young people, adults, people with cerebral palsy that we could look at. So all our question marks were left open. So after a few months, we have been invited, my husband and myself, to this event, but just as attendees, but we have been asked to share in 5 minutes our story. And I think that the video that you be able to find as a TED Talk on the TED platform, it's not as relevant for the fact of being a TED Talk, but more for the fact that was the first time that a child with CP was on such a stage, so it could be a kind of referral of feeling of being represented for 70 million of people in the world like Mario. So this is the number of people with cerebral palsy at global level. So our story, it's basically a story of participation on responsible research and innovation after the few years where we were looking to different type of treatments, to different cure or experiment or different type of research in different parts of the world. We understood that there was not a systemic approach, so we decided to found the foundation and to start piloting some projects that were, I would say, too risky for the traditional research. Our first platform was Mirable, so a telerehab platform based on the action observation treatment. So a mechanism that allows children, especially children with motor impairments, to learn while observing other children. The process for us was, we know that we were having with Mario, with our son, a huge problem, so that he lost almost one hemisphere. But on the other hand, we have been provided by very weak solutions. So the solution provided by the national healthcare system was let's treat Mario with half an hour or 1 hour per week with some stretching to his hands, to his thumbs that was trapped in his hands. And could be eventually the solution for his rehabilitation. So we tried to map the system at that time, and we understood that what was for us called as very naive as a weak solution was a system that had many pains, and we tried to monitor and to put them together and try to understand how we could fix it. So this process with the development of this platform started in 2016, and after a few years, we have been able to enroll children, test families, having very good score in terms of patient engagement, but also in terms of adherence, of compliance to the project, and also in terms of the end goals that were typical from this project. So the motor performance, where kids are going through this platform increase their motor performance. So this was a result for us, and I think it has set the pace of the family engagement in research in Italy, at least, because it was structured in a way in which patients were not just involved just because it's nice to listen to their voice, to do an initial interview at the very beginning of a project, or doing a focus group, or putting dolls on orthotics. So this was the very basic level since we entered this market of engagement of families. So for us was relevant also in terms of some key success factors that we identified when you could assign a solution together with researchers, engineers, or clinical people. So the experience in assessment of the children was really relevant, because when children were too much impaired, or they couldn't move from their house, or their family was busy, because it happens that parents work, and so they couldn't go to the hospital. So in this case, we tested and we piloted a new way of screening these children going directly to their home. Even in the experience of delivering the toolkit of this telerehabilitation platform, which was a home-based platform, was something that was born and developed specifically on the need of the children. So if there were children who were passionate about the hospital, the ambulance, they want to become a doctor, so the toolkit was resembling an ambulance, and all the tricks were studied and designed according to their desire. Even the experience in the usability was a key success factor in the development of this platform, because it was children-friendly, but not in a way, I mean, it was a video delivered on the main screen on the television of their home, and they just need to put a hand on the screen to start the program and connect with their peer on the other side of the world. Another thing that I think also Begonia mentioned is and was for us the importance of sharing back the results, because usually we rush a lot, we run a lot when we need to recruit people to participate to the clinical trials, but then we forget to share the knowledge that we have gained after the clinical trial ends. So even in terms of increasing community knowledge and increasing the level of health literacy of the family, for us was really relevant to share back in a very easy and simple way the results of the project apart from the official publication. The second project that I want to mention to you now is what I was saying at the beginning, which is represented by this logo and the acronym AI and CP, so the Artificial Intelligence in Cerebral Palsy. This is a European project, I would say the largest European project on dealing on artificial intelligence for people with unilateral cerebral palsy. It was won in 2022, and it will last till 2027. The project lead in this case is an academic and a clinical entity. So it's University of Pisa together with Fondazione Stella Maris in Italy. But the group involves 12 partners from 7 countries in the world. And the reason why I mention this project is because, well, the goal is to design a decision-making process for delivering a personalized approach for the rehabilitation of the upper limb in children with unilateral cerebral palsy. But as I was saying, the reason why I was mentioning it, and I am mentioning it, is because the approach since the beginning for the submission of the project and then the everyday project work is a multidisciplinary approach. In which parents and family association are engaged as a partner. So it's not anymore co-design intended like, okay, now we ask to the children and to the parents how they would like to have the gloves, so they would like to have the story, the narratives of the rehabilitation platform, but it's let's get the parents, the children, the young adults with a disability together with us in the table since the beginning. So we have been hired as a real partner. Here there are some few information about the project for those who are not so familiar with cerebral palsy. The target of this project is specifically the unilateral cerebral palsy. So by chance, the case that I was mentioning before with my son Mario. So hemiplegia, this is the most frequent motor type of CP that involves around 40% of children with cerebral palsy. And in Europe, we have every year 5,000 new cases, which accounts for around 15,000 subjects living with this condition in Europe. So the main target of rehabilitation for these children, as you can imagine, they have lost half of their ability to move one side of their body. So it's on upper and then lower limbs, but the main target of rehabilitation is on the most impacted limb, so on the upper limb. And this is the focus of this project too. The aim of the project is trying to have a high personalization of the care, starting from the diagnosis till the rehabilitative treatment. So we are trying to collect images. Maybe I'll show you this slide, which explain better. Okay. We are trying to collect data from everyday life of the children thanks to the wearable device. That could be especially a wrist bracelet trying to collect upper limb movements. We are also trying another source of relevant data for this project is the neuroimaging information coming from their MRI and from all the clinical outcome measurement coming from the clinician. On top of this, we have all the information that can be collected at home once the rehabilitation program will be delivered at their place. So
Francesca, excuse me, 5 minutes, okay?
Okay. So the main aim of this project is to collect the diagnostic and rehabilitation information within a unique tool. The last project that I want to share is the Mirror HR, it's also called an epilepsy research kit. This is a project that we have developed from scratch. So it was based on our idea, our own resources as a grassroots organization. And it's the first epilepsy research kit built together with Microsoft. So during an entrepreneurship project. And again, it was based on the needs of our children with cerebral palsy, in which for the 40% of the case also develop epilepsy. The goals of this project, related to Mirror HR application, the first goal was giving users peace of mind at night. Parents living with young stroke survivors or a young person with CP suffering for epilepsy couldn't sleep anymore. So we also understood that the 70% of the seizures were indicated by a spike in heartbeat. So we developed this app that allows you to set the minimum and maximum BPM thresholds in order to monitor the user heart rate throughout basically the night. So this is app. You have different type of feature that are all in the hands of the end user, so the caregiver or the young adults with epilepsy. But also another relevant goal for Mirror HR development was to provide an online symptom tracker. So something that was not existing before was the possibility for the parents to log all the events and try to add this type of contextual data to the machine in order to let the people understand how these seizures were happening. So this is possible till now on Mirror HR because the family can deliver just 1 minute video at the end of the day. And thanks to the machine learning, we are trying to capture this video and transform this information into symptoms that are correlated with the seizures. The third goal for Mirror HR development was also to foster research initiatives. So our goal was not only to predict seizures, but rather to reduce the frequency and then the severity of the seizures. So understanding the correlation with those contextual data should allow in the next future to understand why these seizures are happening. These are some numbers, but I don't want to focus on these. So I just want to end my presentation with some key learnings that I think resonate a lot with what Jennifer and Begonia mentioned before. So why co-creating with the families, why co-creating with the children, not because it's fair, not because they are those people who pay our salaries, so the people for which our work exists, but also because it's a very effective process. So it's time saving, it's cost saving, it gives you more compliance, more adherence to the projects, but at the end it's a care effective. I will leave you, yes, I will leave you just with this slide because we strongly believe that especially nowadays when we keep on talking about how we can use technology or we want to use a tech which is really on hype and we want to engage family. I think that having a side partner like a family association or a caregiver or a young adult or a child, whenever it's possible, just seated at the table and allow them to co-design the solution. I think this is the best way to build trust and frictionless relationships. Thank you.
Thank you very, very much to all three of the speakers. I think it was really a fascinating overview, and it really, I don't know how much you worked together ahead of time, but I think you really managed to overlap in a very, very positive way between your different initiatives. So thank you very, very much. We have some time now for questions. There were a few posted. I don't know if people would like to ask their own question. James Piercy, are you still on the call? I know that some people had to leave a bit early. Is James still here? He had asked, how did you find, I'm not sure who he asked. I think it might have been Jenny, it might have been you, and I think you may have already answered him, but just in case people haven't noticed, James asked, how did you find and recruit young people to your panels? Do they stay for a long time or do you refresh the groups often? Do you want to just give a brief overview of that, Jenny?
Yes, so my response to James was it all depends on each individual project, really. So obviously we have what is known as a young person's advisory group, which Begonia alluded to. So we've set up our first group in 2006 in Liverpool, and they tend to be generic groups of young people who have varied experiences. So whether they've had clinical trial participation or they have a chronic condition or just a general interest in science, they tend to join our YPAGs. So we can recruit them from anywhere, really. So schools, youth centres, clinics, hospitals, and so on. But if you are, like, for example, Francesca's, experience, if you have a child with a certain condition, you wouldn't necessarily go to those generic groups, and you would set up a disease-specific group to inform whatever project. So it takes a different approach, a different recruitment approach. But it's quite a bespoke ask, really, when you want to do patient and public involvement, and don't just have the easy option to go to a group that exists that has no experience in that condition or that illness or wherever, that experience. So yeah, it is slightly different, and I'm sure Begonia would say the same thing. as
Yeah,
with
Begonia or Francesca, do you want to add anything to that response?
Yes, this is Begonia. We work, as Jenny Preston mentioned, in some projects. Of course, it's so relevant, the experience to live with the condition. This is the case of Francesca's presentation and the projects that I mentioned, for example, about pediatric oncology. We need children and young people with experience living this disease, because until the moment that you are in this position, you never can imagine what means live 24 hours, 7 days per week with a disease. And I like a lot the sentence that my colleague Jenny also shared. This is the value of the patient involvement, the experience that they have, and also the experience not only with the disease of being a child, because for me it's two challenges: be a patient and be a child, and they need to continue as far as we can be children and teenagers. But there are other projects in which the feedback that we need, it's basically in regards of the age of the patients, and see, for example, if an APP is well designed, the information is easy to be understood, etc. In this case, we don't prioritize the disease of the young people that we involve, and we involve these youth councils, these young persons advisory groups in these projects. Every project, of course, it's different. And as I said, always, when we can, we involve the children and the young people. And if for any reason it's not possible, we always also work with the parents' perspective. That also has a lot of value for our projects.
Thank you, Begonia. Francesca, do you want to add anything?
Yes, I think that even the relationship with the families and with the young patients has changed during the latest years, especially with reference to the social media. So Jennifer was mentioning the group of families, the group of patients. So this is a reality, but now 20 years passed since the first groups community on Facebook. So even in this sense, the learning curve and the experience of this community has evolved a lot. So it's not a matter anymore of a doctor posting a recruitment message for a clinical trial on one of these groups, but it's a matter of trying to establish a continuous collaboration with this group, which can go on different levels. Of course, there are parents who like to be engaged more, and they have the experience, or they have the knowledge, they have the right commitment and the right time. And there are others who, on the other end, just want to receive a cure. So I think that having this intermediate level of the family association, of the patient association, it's something that guarantees privacy, guarantees the right tone when we interact with these patients, and at the end, a more trustable relationship and a faster goal that can be reached. So we have seen in the past that when we engaged this level of family association, we reach highest target of redemption for a call, a generic call, compared to those type of projects in which the patients are engaged just at the end of the process.
Thank you. Your experiences very much reflect what's happening in Europe, England, and specifically Spain and Italy, but also, Francesca, with what you're relating to the European network that you're associated with. I'm wondering if you have had any experience with children and youth in other countries, perhaps countries that are less well developed. If there are any indicators that the approach has to be different to accommodate in any way for either issues of wealth or poverty, and issues related perhaps to cultural acceptance in terms of the rights of children. Because even though you, at least two of you, cited the UN not guidelines, I guess it's the mandate, but I don't know how widely those are accepted around the world. Do you have any thoughts about is this a problem, or what, and if it is, what needs to be done to address it? That's to all of you or any of you who wish.
I mean, I'm happy to go first, but I have no experience of, obviously we have connections and networks in different countries, but they tend to be in well-developed countries. But even within our own experience, so the UN Convention of the Rights of the Child it's not legally mandated in countries. It might be, people might have signed up to it, but actually it's not legally mandated, and so there's an issue there. But even within our own country, so even in, like, for example, Liverpool alone, you are still, you still got groups of young people who are completely excluded from any type of involvement activity because it's just not something that they do. So I think our strategies have to be that we have to go out and reach out to those young people. There's no such thing as hard to reach groups anymore. We're just not reaching them. We're just not trying to reach them hard enough. And so we have to build that into our strategy to make sure that we have that at the top of our minds, that we are most of the time involving most privileged children who get involved in everything. So we have to bear that in mind. So, like, for example, I've got a community outreach group tomorrow that I go to, doing a science club in a local community centre, where young people wouldn't necessarily have been given this opportunity to have a voice in how they shape their health. So it's things like that, but it's all a matter of resource in both time, skills, money to be able to do it. So, but that's where the culture of patient and public involvement comes in terms of making sure that it's embedded at the cultural level of the organisation to make sure that, we actually do this properly.
This is Begoña. I agree with Jenny's comments, and I think that we have a lot of unrepresented groups within our countries, kids with disabilities, mental health conditions, because this is, like, in general, also with the adults, involved in research. Usually we go to the patient experts, the ones that already are there, to say yes, and it's more challenging to involve these unrepresented groups. But again, I have mentioned in my talk the word diversity, and I think that a project of patient and public involvement in medical devices or in the drug development or whatever the health setting, it's going to be more meaningful and wealthy if we have the capability to involve these unrepresented groups. In general, I can mention that Europe is really advanced on this in general, but there are some initiatives, for example, in African countries, but not in the stuff that we are discussing today, probably more in regards of health priorities and in the access, for example, to vaccination or some specific treatments that, are challenging still nowadays in some communities. And there are people doing patient engagement in some communities in some African countries. It's a different, world, different environment. But as Jenny said, it's a right. And the point that we need to highlight is that this Convention of the Rights of the Children is endorsed, I think, by less than 200 countries, even big countries that probably we think are, endorsing this convention. They are not in the list. And I think that it's so important to work at country level, but of course, to increase this awareness at international level, that depending on the country and the priorities and the unmet needs, always the patients and the communities of children and young people, they can play a very important role. But of course, probably the resources and the means are less than in the developed countries, because behind every project it's a lot of work and a team of people working with. But yeah, I think that it's a pending subject to be done to make more accessible patient and public involvement within our countries and in some countries in which there is no expertise on this.
Thank you. There's one request from one of the viewers, especially for some of the pictures that Begoña, you had in your presentation. They want to know if they can be shared by email. We have recorded this, and so the things can be viewed, but Begonia, if you want to take a look at the chat and see if you wish to respond to that specific request, you're welcome to do so as you wish. Are there any other items or questions that people would like to raise? I know that the comments in the feedback as people left have been very, very positive. Sandra, I think there's a questionnaire that Bonka used to distribute at the end of the webinar.
Yes, yes.
You want to post that now so that people could respond, and perhaps also email it to the people who left the webinar before the end?
Yes, I was just seeing that Batu, I'm not sure if this, I'm saying this correctly, has raised the hand. So if you wish to make a question, go ahead.
Can you hear me? Okay, sorry for my noise. I have sore throat a bit. Just I am a PhD student, fresh researcher actually, and I am doing some research with children and young people. And I have a patient and public involvement group. But sometimes it is quite difficult about the position of the researcher during patient and public involvement. Of course, there is some level on this patient and public involvement, but it doesn't mean always you can have a good decision or best decision what should be your position for these children and young people, manage these population. How we can decide about this?
I think from my experience, I think it's about managing expectations in terms of being clear at the very beginning of what you know, because not everything people say is achievable, or it can be achieved, you know, and likewise, I think you not to overpromise as well in terms of your patient and public involvement activity. So it all depends on each individual project again, but I think it's about managing expectations to say, right, okay, so you've said this, we tried to do this, but we couldn't because of this, or this. I think it's just a relationship and a conversation, you know, between the young people. And again, not to overpromise that you can change everything, because it just might be physically impossible to change everything. So I would just, I think that there's loads of ways around that in terms of having a young person's agreement, for example, or a researcher agreement saying this is what you'll do, this is what they'll do, and, you know, and then come to a decision, and a joint decision about it in the end. You know, it's not always just because you're a patient that, you know, it's a right thing to say, and vice versa. Not all researchers are right all the time. So again, it's like that conversation that needs to happen.
Yeah, this is the problem actually. People mostly focus on the outcomes of this research or what you do. That is why they want to see what is your result, the end of all these things. And that is why, for my problem,
But the thing is that with research is a long process. So it's building in those like touch points where you can, you know, have a conversation with the young people to say, well, actually, we've taken this to ethics now, or we've done this now, or we've done that, but it takes so long and all of that. And young people are pretty much, they understand all of that eventually, once, especially when you've got a relationship built with the young people. So I would say continue building the relationships, continue having the conversations. Just don't keep young people in the dark in terms of, you know, timeframes can go, and you know, as researchers, you know, they just go, well, you know, just keep the conversations going as much as you can, even through a text message, whatever you do. I mean, we have WhatsApp groups and things with ours, and we just communicate saying, oh, we've changed the meeting today, so really sorry, or all of that. So it's just that constant communication.
Okay, thank you so much.
This is Begonia. I think that it's a matter of common sense to not overpromise, because patients can contribute, as we mentioned, to provide their experience, their feedback, to share their needs, but of course they are not going to discuss technical or scientific things of the projects. And from the other side, the same, to work with the clinicians or the IT people to say, okay, this is the value of the patients in your project, and use this common sense to prepare them about what they are going to receive, that it's going to be, you know, sometimes easy to be implemented, but it's a matter to, to have a real concept about what means, incorporate the patient perspective along the journey, because we have mentioned that at the very beginning it's the better, but probably at some point the team of this project, they came to us again to say, okay, this group that was involved at the very beginning, we need again their help because we have now the challenge or these problems. I think that it's a matter of common sense and to build this trust and this, feeling to belong to these communities, these boards, to, be, alongside the whole, development of the projects.
I think, Begonia, that is also a matter of shared goals. So as both of you were mentioning at the beginning, the fact that being fair and sincere with no hidden agenda since the beginning, try to establish a long-term relationship. So we know that building trust, it's not something that happens in 5 minutes. Establish a long-term relationship means sharing results, trying to engage your target audience in different events. For example, last day, one researcher told me, I was asking if I could attend a seminar, a conference, was very technical, very scientific. Probably I couldn't get all the things, but they say, no, you're not allowed because, of course, you are not going to understand anything of what we are saying. So this type of comments, this type of feedback, of course, do not allow to establish a fair relationship. And of course, being conscious of the fact that this for you, it's a job, it's a work, and for me, it's my life. So it's not something, so that there are different levels of to keep in consideration.
Thank you for all these answers. Thank you so much.
Okay, are there anything else? Betul, will you remove your hand just so that we realize that you've been answered? Is there anybody else who has any comments or questions or remarks? I just want to draw your attention in the chat to the form to fill in to give some feedback to the webinar. It really helps us when we plan our future ones to know if we've hit the right tone or not. So please do fill it in. And Sandra, perhaps you could send that somehow to the people who had to leave already. Okay, so again, I would like to thank you all for attending, Sandra for the great organization and running of the event, and of course to the 3 speakers who I think, you've shared what sounds like your life's work, not that you are stopping it anytime soon, but it's truly inspiring to see the kind of effort you make and the kind of successes that you have achieved so far. So thank you all very much, and we're looking forward. Excuse me, just before we just finally sign off, Sandra, do you happen to remember the date of the next one? I think it's in 2 months' time. If not, we'll send out a notification. Do you remember the date?
We will send out notifications. It is scheduled for the 7th of May. So we will have our next seminar in May, but we will make proper communication and dissemination strategy near that point.
Great. Okay, thank you all. Bye-bye.
Thank you.
Thank you.
Ciao.
Goodbye.
Bye.
Bye.
Bye, and thank you to everyone.
Bye.
Great speech.
Bye.
Thank you. Bye-bye.